Hello everyone, welcome to my channel Human Health Info. Today we will discuss about female infertility. Please watch the full video to understand everything. Female infertility overview. Definition of infertility is try to get pregnant for at least 1 year without success with frequent sex. Millions of couples are affected by female infertility, male infertility or combination of both. The percentage of couples who are having difficulty to get pregnant or deliver successfully is approximately 10 to 18. About 1/3 of time it's because of female and about 1/3 of time it's because of male. In some cases the cause is untraceable and other cases it's because of both male and female factors. Sometimes it's get difficult to diagnose the cause of female infertility, but in more cases it's curable. There are many treatments available depending on the cause of infertility. Many of the infertile couples may succeed to conceive without treatment. The success rate is also higher. About 95% of couples conceive successfully after trying for 2 years. Symptoms. There is not a large number of signs or symptoms for female infertility. Unable to get pregnant after trying for a long time is the main symptom. But you may know that you are not ovulating from a too long or too short menstrual cycle, 35 days or more, less than 21 days, irregular or absent any cycle. No other external symptoms are available. When to see a doctor. When you should go to the doctor depends on your age. Before testing or taking any treatment, most doctors may recommend you to try for at least 1 year if your age is more than 35. After trying for 6 months, discuss your problem with your doctor. If your age is between 35 to 40, your doctor may start the testing or treatment immediately if your age is more than 40. In case if you or your partner has a known problems with fertility, history of your periods are irregular or painful, you have pelvic inflammatory disease, previous cancer treatment, endometriosis or a history of repeated miscarriage, then your doctor may start the testing and treatment process immediately. Cause. To become pregnant, every factor is detailed below is important. You have to ovulate. Ovaries produce and release an egg every month is called ovulation. It's very important for you to have ovulation to get pregnant. To access your menstrual cycle and confirm if you are ovulating or not, your doctor can help you. Your partner needs enough sperm. In most cases, between the couple's male partner don't have enough sperms to conceive a child. But doing few simple tests will confirm your partner's sperm health to the doctor. You need to have sex regularly. During your fertile period of month you need to have sexual intercourse regularly. When you are most fertile in every month, your doctor can explain you better. You need to have fallopian tubes opened and a normal uterus. Fallopian tubes are the places where the egg and sperm meets, and to grow the embryo need a uterus that is healthy and have the capability to carry the embryo. It's very important to get pregnant that every step has to be correct of the process of human reproduction. Process are listed below. A mature egg is released by one of your 2 ovaries. Fallopian tube pick up the egg. Sperm reach the egg to fertilize by swimming up the cervix, through the uterus and into the fallopian tube. From the fallopian tube to the uterus, the fertilized egg travels down. The fertilized egg grows in the uterus after implantation. There are many factors that can disrupt at any step of this process in women and that can result in fertility. Factors listed below is the cause of female infertility. Ovulation disorders. If your ovulation is irregular or you don't ovulate at all, this is called ovulation disorders. About 1 in 4 couples who are infertile because of this. Problems created by the hypothalamus or pituitary gland with the regulation of reproductive hormones or any problems in the ovary can cause this ovulation disorders. Polycystic ovary syndrome, Pcos. Hormonal imbalance caused by Pcos affects ovulation. Insulin resistance, obesity, growth of hair on the face or body abnormally, acne etc. are caused by Pcos. This is often the most common reason for female infertility. Hypothalamic dysfunction, follicle stimulating hormone, FSH, and luteinizing hormone, LH, are the two hormones produced by the pituitary gland which are responsible for every month's ovulation stimulation. Production of these hormones and ovulation get affected by excess physical or emotional stress, a body weight that is very high or very low, sudden weight gain or weight loss. Signs are commonly irregular or absent periods. Premature ovarian failure. If the ovary of women under the age of 40 years stop eggs production and lowers estrogen production is called premature ovarian failure. Primary ovarian insufficiency is the other name of premature ovarian failure. Autoimmune response or premature loss of eggs causes this disorder. Possibly it's genetics or because of chemotherapy. Too much prolactin. Overproduction of prolactin, hyperprolactinemia, is caused by the pituitary gland. Excess prolactin can reduce the production of estrogen and may cause infertility. Often it's caused because of pituitary gland problem, but sometimes medications you are taking for another disease can cause hyperprolactinemia. Damaged fallopian tubes. Tubal infertility. Sperm kept away or blocked the passage of fertilized egg done by damaged or blocked fallopian tubes. Fallopian tube damage or blockage causes are pelvic inflammatory disease, chlamydia, gonorrhea or other infections that are sexually transmitted. Infects the uterus and fallopian tubes. Previous surgery in the abdomen or pelvis. Surgery for ectopic pregnancy, where a fertilized egg implantation and development happens in a fallopian tube instead of uterus, is known as ectopic pregnancy. Pelvic tuberculosis. Worldwide it's a major cause of tubal infertility. Endometriosis. Extra tissue that grows in the uterus and other locations is known as endometriosis. This tissue needs surgical removal that can cause scarring, which may keep an egg and sperm separate by blocking fallopian tubes, affecting the lining of the uterus. Disrupting the fertilizer egg implantation can caused by endometriosis. By damaging the sperm or egg, it's indirectly affect the fertility. Uterine or cervical causes. By interfering with implantation or increasing the chance of miscarriage, fertility can be impacted by several uterine or cervical causes. Problems with becoming or remaining pregnant can caused by the abnormal shape of uterus, which abnormalities present from birth. An inherited deformity or cervix damage can be cause of cervical stenosis and narrowing of the cervix. Sperm needs best type of mucus to travel through the cervix into the uterus, but sometimes the best type of mucus can't be produced by the cervix. Fertility can be affected because of blocking fallopian tubes or interfering with implantation by common uterus benign polyps or tumors, fibroids or myomas. But despite having fibroids or polyps, many women becomes pregnant. Implantation can be disrupted by the scars or inflammation of endometriosis within the uterus. Unexplained infertility. In few cases the cause of infertility is unfindable. Several minor factors combination in both parents could be the cause of unexplained infertility. Not getting specific answer may be frustrating, but with time this problem may correct itself by own. Still, treatment for infertility should not be delayed. Risk factors. You may have a risk of infertility because of the following factors. Your age. Your eggs in quantity gets poorer as your age increases. Follicle speeds get ruined at the middle of age 30, and because of this eggs quality gets fewer and poorer. Conception gets more difficult. Also the risk of miscarriage increase because of this. Smoking. Risk of miscarriage. Ectopic pregnancy increased by smoking. Your cervix and fallopian tubes may get damaged because of this habit. It may also make your ovaries weaker and prematurely exhaust your eggs. Before starting the treatment process of fertility, quit smoking first. Weight. Normal ovulation may affected because of being overweight or underweight. Frequency and chance of pregnancy may increase by having a healthy body mass index, BMI. Your sexual history. Two sexually transmitted infections names are chlamydia and gonorrhea, which may damage your fallopian tubes. Your risk of these type of infections get increased if you have sex with multiple partners without protection. Later fertility problems may cause because of these infections. Alcohol. Everyone knows that consumption of alcohol is not good for their bodies, but sometimes it can result fertility problems as well. So limit the consumption of alcohol and don't drink more than one per day. Prevention. Following tips may help to increase fertility for those women who are trying to get pregnant. Maintain a normal weight. Ovulation disorders risk increases for the women who are overweight or underweight. Exercise moderately can help you with losing weight, but your ovulation may affect it if you do intense exercise where you exercise per day more than 5 hours. Quit smoking. Besides having negative effects on your general health and the fetus health, tobacco has many negative effects. Immediately quit smoking if you are trying to get pregnant. Avoid alcohol. Fertility can be affected by the consumption of heavy alcohol. A health of a developing fetus can be affected by consumption of any kind of alcohol. Avoid alcohol if you are trying to get pregnant or already pregnant. Limit caffeine. Your ability to get pregnant will not be affected if you intake caffeine per day less than 200 milligrams. The measurement is 6 to 8 ounces in 1 or 2 cups per day. Reduce stress. If you can find a way to reduce stress in your life, do it before you start trying to get pregnant, because in some studies they have shown that fertility treatment doesn't work properly for those couples who are experiencing physical or mental stress. Diagnosis. Seek help from your doctor for treatment if you are trying for a reasonable period and unable to conceive a child. Your doctor will do some of these fertility tests. Ovulation testing. The surge in luteinizing hormone, LH, that occurs before ovulation can be detected by the kit of ovulation prediction at home. After ovulation, a hormone is produced which is called progesterone. This progesterone and hormone levels like prolactin can be checked by a blood test. Ovarian reserve testing. Which quality and quantity of eggs are available for ovulation? This test helps to know that women older than 35 and those who have a risk of depleted egg supply may suggest to do this blood and imaging tests by their doctor. Testing other hormone. Reproductive processes are controlled by hormones like thyroid and pituitary. Testing of other hormone may include these: hormonal level check, hysterosalpingography to detect uterine cavity abnormalities, and X-ray is taken by injecting fluid contrast into your uterus during hysterosalpingography. Then sees the fluid movement, like if it passes out of the uterus and go to your fallopian tubes or not. You will need further evaluation if any kind of abnormalities found. By flushing out and by opening the fallopian tubes, fertility may improve by the test itself in some cases. Imaging tests. Diseases of uterine or fallopian tubes are tested by a pelvic ultrasound. On a regular ultrasound, that details of uterus can't be seen. Sometimes a sonohysterogram used to see those details inside the uterus. Your testing may include following tests depending on your problems. Hysteroscopy. Diseases of your uterine or fallopian tubes can looked by hysteroscopy. A hysteroscopy test can be requested by your doctor depending on your symptoms. Laparoscopy. To examine your fallopian tubes, ovaries and uterus, laparoscopic surgery may done. The process by making a small cut under your navel and for examine inserting a viewing device that is thin is called laparoscopy. Problems with the ovaries and uterus. Endometriosis, scarring, blockage or abnormalities of fallopian tubes can be identified by a laparoscopic surgery. Genetic testing. If infertility caused by any genetic factors, this test can confirm that. Treatment. There are many factors that plays a role in infertility treatment. The cause of infertility, length of the time you are infertile, your age and your personal preference has effect on infertility treatment. The commitments of significant, physical, psychological, Time and financial are involved in infertility treatment because it's a complex process. Moreover, just one or two therapies needs to restore fertility for some women, but for some women several different types of treatment may also need. Through medication or surgery, treatment can be done to restore fertility. Otherwise, sophisticated techniques will help you to get pregnant. For those women who are infertile because of ovulation disorders, fertility drugs can help in regulating or stimulating ovulation. The main treatment for those women is fertility drugs, follicle-stimulating hormone, FSH, and luteinizing hormone, LH, are the names of hormones which are natural. Generally, fertility drugs work like these hormones to trigger ovulation. The drugs is used for those women who already ovulate to stimulate a better egg or making an extra egg. Fertility problems can be corrected or improved by several surgical procedures also. But nowadays fertility drugs are very successful, so only for some rare cases need surgical procedures. Risks of fertility drugs. Long-term use of fertility drugs can increase some risk, like pregnancy with multiples. There is a low risk if multiples of medication is oral. Percentage of risk of multiples is less than 10 for oral medication. Chance of twins can be increased by oral medication. Percentage of risk of multiples with injectable medication is more than 30. This plays a major role on multiples pregnancy. Triplets or more higher order of pregnancy can occur because of this injectable medication. Premature labor risk get increased if you are carrying multiple fetuses, and it can affect on baby's weight later. If too many follicles develop, then medication adjustment can sometimes lower the risk of multiples. Ovarian hyperstimulation syndrome, OHSS. To induce ovulation, fertility drugs can be injected, and that can cause OHSS. Ovaries get swollen and painful because of OHSS. Mild abdominal pain, nausea, vomiting, bloating and diarrhea are the signs and symptoms of OHSS. Usually without treatment the signs and symptoms goes away. The symptoms may last for a few weeks after you become pregnant. In rare cases, weight gain, enlarged painful ovaries, breath shortness or fluid in the abdomen can caused by OHSS. Risks of ovarian tumors. There are few long-term risks of using fertility drugs suggested by most studies, but some studies also suggest that in future risk of borderline ovarian tumors can increase if without a successful pregnancy. Fertility drugs are taken for 12 months or longer. Ovarian tumors risks are more for those women who never had any pregnancies, so it may not be because of fertility drugs but related to an underlying problem. In the first few cycles, success rate is higher. Every few months evaluating medication is used and concentrate on the success of treatments. Fertility restoration surgery. Female fertility problems can be corrected or improved by several surgical procedures. Because the rate is higher of other treatments, so rarely need surgical procedures. Some procedures are laparoscopic or hysteroscopic surgery. Your chance to get pregnant can be improved by these surgeries that can correct or remove any kind of abnormalities. Ovarian drilling or follicle rupture can be done by these surgeries. Other issues can be solved or improved are removing endometrial polyps, correcting the abnormal shape of uterus, removing pelvic or uterine constancy, and removing fibroids that has misshaped the uterine cavity. Tubal surgeries. To remove constancy, enlarge a tube or create a new opening of tubes. Your doctor may suggest a surgery called laparoscopy if you have blocked or filled with fluid fallopian tubes, because the rate of IVF is better. This surgery is done rarely. Pregnancy chance with IVF can improved by removing your tubes or blocking the tubes near the uterus. Reproductive assistance. Methods commonly used for reproductive assistance are intrauterine insemination, IUI. Near the time of ovulation inside the uterus, millions of sperms which are healthy get placed during IUI. In vitro fertilization, IVF. After collecting mature eggs from a woman, in a dish of lab eggs and man's healthy sperms put together for fertilization. After it gets fertilized, transferring the embryos into the uterus is called IVF. The process requires blood tests frequently and hormone injection daily, so the cycle takes several weeks. Between every reproductive technology, IVF is most effective. Thanks for watching. If you like the video, then please like, comment, share and subscribe to my channel.